is CBS 2 News This Morning.
Today in Health Watch, a new medical device restores vision in the legally blind eye of a New Jersey man.
His was the first procedure of its kind in the New York City area. Dr. Sapna Parikh is here with more on this incredible story. Good morning.
Good morning, guys. The gentleman you're about to meet is now able to see through his left eye for the first time since 1968. And that's thanks to an artificial corneal implant, another advance in medical technology. When Pasquale Iacoviello was in his early 30s, he suffered a chemical injury while working as a construction worker. It left him blind in his left eye.
It was terrible. Very terrible, you know, as a young fellow.
He went on to have a corneal transplant from a human donor, but his body rejected it. 4 months ago, Dr. Ilan Cohen from the New York Eye and Ear Infirmary implanted an artificial cornea into Pasquale's eye.
I think the device is an incredible leap in technology.
The cornea is the front part of the eye that focuses light rays coming in. It can be damaged by injury or certain conditions. The artificial implant is thin and flexible. The center part is clear for light to pass through, and the white rim has tiny holes for blood vessels and scar tissue to come in. This holds the implant in place. The surgery is in 2 steps.
In the first stage, we create a plane inside the cornea where we implant this device.
Then the eye is stitched shut. That can be uncomfortable, but it's necessary for protection. In the second part of the surgery, about 3 months later, the surgeon opens the eye and takes out the protective membrane.
For me, it was recovered the same day. I never felt anything.
After 3 months of being shut, you may have noticed that Pasquale's eyelid is still drooping.
This will usually resolve with time.
There are a couple other risks. As with any surgery, there is a small chance of infection, and there's a 20% chance that the implant won't be accepted.
The good news is that if this device fails, we can always take it out.
So with this new implant, somebody that was previously completely blind in that eye can potentially see 20/20?
Absolutely.
And that's if the blindness is because of corneal damage and the eye is otherwise healthy. Pasquale's vision is now 20/40, and Dr. Cohen is hoping that will eventually get close to 20/20. The artificial corneal implant is not a treatment for cataracts or for macular degeneration. It's only for blindness that's caused by damage to the cornea. It's still very new, so there is not a lot of information yet on just how well it'll work in the long run, but still very exciting.
Did insurance cover that process for him?
It does. It's approved to be covered by Medicare, and some private companies do cover it as well.
You can see the results from a smile. That it's an incredible process.
He's very excited.
Dr. Parikh, thank you very much.
Thanks, guys.
All right, your time now is 5:47 right now. Other news, Kellogg's is caving in to consumer pressure.